My name is Nora Willis. I'm from the DFCS Director's Office, and we welcome you to our new quarterly DFCS Community Forum series that we are kicking off to be able to share information with you. I am just going to go over some quick reminders, meeting reminders. First, please do keep yourself on mute unless you are speaking. The presentation is being recorded and will be available within the next week or so on the same link where you found the presentation slide set. Okay, there will be time for questions at the end of each topic. If you have questions during the presentation, please do type them into chat. You can hold your questions until the end when we can take in verbal questions, but our preference is that you do use the chat so that we can ensure we collect them all in case there isn't time to answer all the questions. Next slide, please. And here's our agenda for today. We have an introduction of our executive team, our directors. Then we will Dan will give a short recap of the February Continuum of Learning that we just hosted. That will be followed by Children of Color Work Group update, then Children's System of Care update, oh, typo, and then Local Continuum of Care build-outs update. That'll be followed by any general Q&A and then a wrap-up. So with that, I'm going to go ahead and hand it off to the directors for their introduction.
Thanks, Nora. Good morning. Good to see so many people. I'm Daniel Little, I'm the Director of Department of Family and Children's Services. I'll go ahead and let Damien and Wendy do an introduction as well.
Good morning. I am Damien Wright, one of the Assistant Directors for Department of Family and Children's Services. Glad to see you all.
And good morning, all. My name is Wendy King-Roush, and I am the partner to Damien as the other Assistant Director with Department of Family and Children's Services. Good to see so many faces this morning.
Thank you. And you'll be hearing more from Wendy and Damien, and they both have items to discuss. So real briefly, the DFCS has been doing a continuum of learning. I think we're on our 4th year. This year, we're actually going to do it twice a year. So our next one is August 30th. And our continuum of learning is an opportunity for us to share some of our data outcomes and really provide some tangible examples of some of the work we're doing. I think that we've heard loud and clear that providing some of the family level experiences and examples has really been what groups have wanted to hear about. So at this most recent continuum of learning, we actually were able to hear from one of our managers, Michelle Finley, and one of our supervisors, Bob Beck, regarding their work on engaging families through emergency response. And I think it was a really insightful presentation, and looking to do more of that moving forward. So again, our next one is August 30th. Should be some information going out later this before that time to talk about registration and you know, I think it's probably still up in the air if this is going to be a Zoom or in person. We'll kind of see what happens, but I'm guessing it'll be kind of at least a hybrid. There'll be some aspect of a video presentation. The other component is during this last continuum, we were able to share kind of our relaunching. I don't think it's been, at least since I've been here, we haven't had an annual report. So DFCS annual report that goes through the different programs success, as well as some of the major initiatives that we're working on. So a large group that represented many different areas within DFCS that helped pull this together. If you haven't seen this, there'll be links to where you can find this information. But as you're reading it, know that the stories and the information is coming directly from the program staff. So it wasn't the executive team that wrote all of it. You know, we helped provide some technical guidance, but the examples and the words in there really are from the program staff. So very excited to be able to share the work that we're doing. Talk about some of the future work like FFPSA and a lot of our prevention work, which you're going to hear about later today, as well as our local continuum of care, which you're going to hear about today. But again, really excited to share that. The last thing I think before we move on to the next agenda item is this meeting kind of evolved, our provider meeting. We've been doing a monthly meeting with DFCS staff to where we can provide updates and answer questions and really give staff an opportunity for question and answer. We also used to have a kind of an internal county provider meeting where we would be able to share information internally with other county and social services, specifically departments. And we really wanted to have a forum where we could share some of the same information we're providing to DFCS staff, but in really an open forum that anybody can join in. So that's what you're going to hear today. So this is going to be some of the high level information that we've provided over the last quarter to our staff. So you're hearing it directly from us. And then at the end, just like with our staff, leave space for some question and answer. I do know that we received one question, I think, before the meeting. So Nora, at the end of the meeting, I think we'll talk about how we can elicit information and get questions from you all ahead of time. But again, also able to answer questions at the end of the meeting. So again, thanks everyone for taking the time. And I think we'll move on to Rocio.
Sorry, having technical challenges, and hopefully you will be able to hear me because of those technical challenges. But good morning, and I wish I can see everybody. There's too many people to see everybody in the room, but I'm hoping that we have some Children of Color alumni as well as active participants. So my name is Rocio Bundis, and I'm the manager that oversees the Prevention Bureau, and I have been working with Children of Color for about 5 years now, directly, meaning being the facilitator of it. So it's been exciting to be part of the Children of Color. It is a eclectic group of participants from internal staff to system partners and community members, and it has been in existence since 2003. Can you forward to the next slide, please? So, at the next slide. Okay, so it's been in existence since 2003, and the vision of it has been consistent, and that is about reducing the overrepresentation of children of color, specifically African ancestry and Latino communities. So think about that, 2003, that's been about 20 years, and the challenge and vision has been the same, not only for that group, but for the department as well, as it's so difficult to affect change in this area. The goal really has been about enhancing and developing community services so that families will have available preventative support, and the key word there is preventative support, to prevent them from getting into the child welfare system. Next slide. So as I mentioned, they have been around since, from being active participants in lobbying for change, to implementing change, to being thought partners, to being data watchers. So the role and how they've accomplished that mission has varied. But over the past 20 years, they have accomplished a tremendous amount of work, either directly or indirectly, in supporting the department. Some of the key wins I just really wanted to highlight, because they're so important to the work that we're doing, is differential response. Launched back in 2006, and now we have a community prevention pathway, which I will be talking about in a little bit, which is brand new and unique to this DFCS, and I don't believe anybody else is doing that. Cultural Brokers also is a product of this committee, in the sense that they did a lot of research, researched Fresno County's model, brought the ideas to this county, and lobbied to get this started, and Cultural Brokers was able to launch in 2017. They were also roll out the child and family practice model, which is really the core of and the foundation of how DFCS works with families. And part of that was to help support the rollout of fidelity assessments to make sure that the model was being implemented to fidelity, including coaching support and training for staff. They were also able to help leverage and create a grant proposal for RAP reinvestment dollars in 2017. And from that funding, we were able to get our first community liaisons to be out in the field, to be out in community, in the space, and having their eyes and ears out and listening to what the needs are and bringing them back. Dually Involved Unit was another product in the Prevention Bureau, which has been in creation since 2017 and then fully became a bureau in 2020. Next slide. So as I mentioned, we really try hard to monitor data over time. We were able to create a dashboard that DFCS manages before we had a contractor that was providing us with data. So this dashboard we get every 6 months. We were doing it initially monthly, but it was too short of a window to even see any change. So this dashboard shows basically affirms the disproportionality that exists. While we know that African ancestry is just about 2% in the community, they represent 6% in child welfare in terms of the referrals coming in. Similarly, for Latinos, it's 36% in the community, yet they represent almost 60% of the referrals coming in. The next chart over allows us to look at what that disproportionality looks like in different stages within our system, so we can monitor and track changes. There are other dashboards and data sets that we have that I'm not showing here because otherwise this will become a data presentation, but we have data that looks at disproportionality around target zip code areas. We have 6 target zip code areas, Gilroy and East San Jose, that we track very closely because they are the highest in terms of disproportionality. And they're also the zip code areas that the Prevention Bureau has been focusing on. So we have zip code data, and we also have a 5-year trend analysis that helps us look at the data on a different scale. So next slide. We also want to make sure that as we're looking at data that we're aware of what are the changes that we're making in the system and how does that affect the results. And as I mentioned already, differential response being a key one. Several of these I've already mentioned. I also want to mention we have a strong partnership with the Child Abuse Prevention Council, and we started a Healthy Relationships campaign, which is a preventative messaging out to community in 2018, and we're continuing to do that work, and now we'll be doing some audio messaging in all of the county lobbies throughout the county. We also, as I mentioned, we try to hear what are the needs of the community. So there was a Child Abuse and Neglect Prevention Summit that we launched back in late 2018. And that has helped to inform us what the needs are of the community and helps to inform the Prevention Bureau what work we need to do. Also just wanted to highlight the mandated reporter training. While it had been in existence well before 2018, we did a total revamp of the curriculum to have more rigor and consistency, but also to address disproportionality and what it looks like in community, to talk about poverty and how that impacts families, and that it doesn't always necessarily equate neglect, and to also infuse cultural humility and potential reporter bias in the training. So those are really huge changes that we made to that curriculum. And then the Prevention Bureau started to launch a lot of different programs. So the Resilient Families Program, Parent Cafe, oh my gosh, I totally drawing a blank on the others, but I'll address this in a second. So this just shows the key strategies over a timeline and us trying to be aware of how that impacts our results. So next slide. So here's just an example of the 5-year trend analysis. So because we have targeted zip code areas, here's an example of what it looks like for Gilroy, and looking at the different decision points. So we know what the population is, and we're able to compare that to referrals, substantiation, voluntary cases open, and I can't see because my computer's open, and entry into foster care. So we're able to look at this for each zip code area to make sure that the trends are going in the right direction. They may not be at elimination of disproportionality, but to at least show that we're making some good strides is what's really important. Some of the east side zip code areas are really where we need to put more focus on, and I would love to throw some more community workers out there, but some of those zip code areas are struggling to show a trend in a positive direction. So this is just an example of one of the data points that we have. Next slide. It's also really important. I am always saying that it's impossible for DFCS to address disproportionality alone, because we were talking earlier about root cause analysis. We know that these families are impacted by lots of different systems, not just DFCS. And so we always have to be in communication with others. So every quarter, we have some of our partners come and speak to children of color about their efforts to address disproportionality. So these are just some examples of the different committees or groups or initiatives that also are addressing the same work, and they come and they share with us at Children of Color what they're doing. Slide. So generally, we're not a implementation group. We're more, again, about lobbying and monitoring data, but there are occasions when we do agree to host special projects. I mentioned the Child Abuse Prevention Summit. There are many folks in the Children of Color that were part of that, but I also brought the information and the recommendations from that summit to the Children of Color, and they have been able to provide feedback to inform that work. So a lot of that back and forth is really important, those communications. I did want to mention we call it Path Zero, which is really the prevention pathway for differential response, is a huge accomplishment that was launched in 2020. This has been a discussion of the Children of Color for many, many years, and came out in a retreat that happened, oh my gosh, I want to say maybe 5 years ago. And everyone in the room felt that we need to reach these families earlier, well before the phone call comes into the CAN Center. And so now the supports that are available from differential response for our families are now available for community members. They can self-refer, but we also are targeting some of the districts that are in our high zip code areas, such as Morgan Hill, Gilroy, Elm Rock, Downtown College Prep, and we are getting ready to sign agreements with Campbell Unified and San Jose Unified, which is a huge school district. So that will allow entry point into differential response services. That is a very huge win. Our current project right now, and there's a subcommittee that's working on it, is to help look at what, oh my gosh, I'm drawing a blank on the name. Andrea, help me out. The committee, the staff committee, the African Ancestry Staffing Committee, what is their name?
African Ancestry Employee Committee.
Thank you. I can never remember that. Thank you. Too many acronyms. So that committee actually came together and created a community resource guide that specifically supports the African ancestry community. And so at DFCS, we looked at it and felt that there was a lot we can embellish on it, add some more information to make it available to social workers. So it'll be designed with the lens of what a social worker needs to refer to families. So this is an active project that a handful of people are working on, including Andrea. And we hope to actually even create some virtual platform where DFCS social workers can access information that is unique to families that are in the system. We don't want to recreate a 211, but we do want to make available resources and information that is unique to those families in our system, in particular, those that we contract with that are not available to the public. So that is a project. It's a big lift, but it's a huge priority for me. So I really want to make sure that that actually happens. And I think I'm at my 10 minutes, so I'm going to stop and pause and allow for questions. Or I know there's a lot of people on the call that are also part of Children of Color, so if you wish to add anything as well. And yes, I can provide the dashboards to everyone.
Do we have any questions?
Well, thank you. Thank you. This is Marty Estrada from an agency in Gilroy called CARAS. Thank you so much for your presentation there. There's a big need to talk about what we're facing and what can we do to work together regarding the disparities that we have here in Gilroy.
Yes, well aware of that, absolutely. And I would include Patty Pena in that discussion, who's the community worker out in Gilroy and is very close to the ground in terms of what's going on. So absolutely would be open to having a conversation. If you can put in the chat your contact information, I'd be happy to reach out to you.
Thank you so much.
Absolutely.
Any other questions?
Awesome. Well, thank you for allowing me the time. Oh, I think Maxine has a question, and I see a couple of hands, but I can't tell who they are.
So Dr. Yanis?
Yes.
Do you have a question?
My question is, we all know that mandated reporters by law are the major way of connecting to families in need and in crisis. And we also know statistically that 80% of the calls are not substantiated. Therefore, they are kind of either evaluated out or dismissed, but the need persists and the risk of referral again and again continues. That's why the differential response 0 is so critical, so that we can repair and restore to healthy strength and maintenance of families who are not yet to enter the system, the foster care system. What do we do to retrain and inform all those who are mandated reporters to become mandated supporters so they don't have to pass through the CAN center?
That's a really good question. That is part of the shift that we're trying to make with the changes to the curriculum. In the training that is provided at the end, we also provide resources to the attendees. And we encourage exactly what you said, encourage them to be mandated supporters and to use the resources when appropriate. If they feel like, for example, if it's a child that's coming to school, you know, unbathed and maybe not properly clothed, that is something that perhaps the family just needs to be connected to a resource. So that's absolutely something we're trying to emphasize, but we need to continue to do that to the extent possible.
And at the same time, are these going to be reflected in our statistics, in the data and in the evidence-based data that we have to receive every day to know how the system is changing?
Do you mean how is the training affecting our data?
Right.
How is the
right? Well, that's the CAN center has statistics that refer to the county about the number of calls and what these calls are being decided with. So that's it is going to reflect that the 20,000 calls become really like 20, 10, 1,000, 2,000.
Yeah, I mean, I think that's a really tough question. It's hard to make a direct correlation between the training and the calls coming in because there's so many other prevention things that we're doing that can also affect that same number. But we are trying to look at trends in our CAN center data overall. But can we equate that to the training? That would be very hard for us to single that out. But my hope is that with the training and all of the other preventative efforts that we're seeing less calls coming in, calls that shouldn't be coming in, I should say. We don't want to discourage calls that are appropriate to come in. We want to discourage calls that can be easily referred to a community resource. So it's a good challenge for us, Dr. Yanis. I think we always have to keep looking at the data, and it's a CQI challenge for us as well. I know there's another hand up, but I can't tell who it is.
Right, so we need to move on to the next topic to make sure that we get to all the topics. So maybe Rocio, you can put your contact information, or actually, for Dr. Yanis if he needs to talk with you further.
Rocio,
Yes.
just a quick question. How many calls are you getting per year?
So I'm looking at last year's 2021 report. There were a total of 24,500 calls came in. That includes everybody. That doesn't include, you know, who's been evaluated out, who's been investigated, but that's just a high level number. So it's a huge amount of calls. The CAN Center has a huge lift. And that's a huge responsibility in terms of training the reporters to make sure that they're making the appropriate calls.
And maybe thank you, Rosie, and thank you for the good questions. Maybe Nora, at the end, we can also include the link to our website where people can go on and get those fact sheets that are available. That would be good.
Yes, do that. All right, we're going to go ahead and, so Rocio, there's a question, if you can take a look at it in chat. And now we will start with Children's System of Care update. So I will hand it over to Wendy and Margaret.
Thanks, Nora. Hello again. So I am here to present on the Children's System of Care update, otherwise known as AB 2083 or Assembly Bill 2083. And I am going to be partnering this work and sharing this presentation today with Margaret Ledesma from our county behavioral health system. Next slide. All right, so I'm just going to start off on kind of giving, setting the stage for what is Assembly Bill 2083. So this was a mandate that was signed into law in 2018 for all counties in California, and it requires each of us as county entities to develop a memorandum of understanding, otherwise known as an MOU, setting forth roles and responsibilities of certain agency or system partners. Basically, those are partners who are serving children and youth in foster care who've experienced severe trauma and require some things of how we work together and how we serve children and how we serve families. Next slide, and I will hand this off to Margaret. We're going to share this back and forth.
Hey, thank you, Wendy. And so, as Wendy stated, AB 2083 was established to set up a children's system of care. And a children's system of care is a structured relationship between organizations and agencies responsible for the wellness and health of youth and families within their shared jurisdictions. The heart of the work is really places children and youth and families at the center of decision making and seeks to provide integrated services that are informed by the values and principles of race, equity, cultural humility, and trauma-transformed practices. I think the most important piece of what I just said has to do with the words around integration and the guiding values and principles. So we have them listed here, but what really is the driver for the children's system of care is really a broad understanding about what it means to provide services that are integrated, family-centered, and hold race equity, and cultural humility at the heart to provide services that are informed by trauma-transformed practices. Look at next slide, please.
So, process for developing the system of care. And one of the statements that Margaret and I, in sharing this responsibility, like to say is that the underlying principle of this is sharing ownership and sharing decision making. So making sure that all the agencies that are involved are sharing risk, responsibility, and reward with families and children. So what has been the process of developing that systems of care? So the core agency partners that are required to have stepped up and signed this MOU are child welfare, juvenile probation, county office of education, regional center for us in Santa Clara County, this is the San Andreas Regional Center, behavioral health, and the additional partners that have signed on in Santa Clara County is public health, law enforcement, our juvenile court partners, and First Five. So all of those partners have signed off in this shared MOU for the collective responsibility for children and youth, agreeing to share resources, agreeing to have shared decision making where all partners, including youth and families, are equal and share in the outcomes. And as Margaret highlighted, all of this is consistent with the integrated core practice model that ensures that race and equity is at the core of what we're doing, that we are making sure that families and children are the decision makers of their own lives and their own decisions, and that they are thriving in safety, healthy, stable homes and workplaces and communities, and that all of us as agencies are working together with the same rules and responsibilities. Next slide.
So this is a visual of what the integrated core practice model looks like. It again holds the family at the center of the work, so that we're working with and not for and to with families. It shows the partners that are involved, and really it's a practice model that has integrated the California practice model, which was discussed earlier, and safety organized practice. And this is the one model that is utilized in every county around how we do engagement and with families, and how we have a process for which there's decision making where families are at the center. And again, that is often called a child and family team meeting. And this is the teaming process that's delineated here. And this is the process that we are using with our pathways to wellness as well. Next slide.
The next two slides are just different pictorials that let you know kind of what we're going. So the current system in place leaves quite a few silos across the county, experiences in services, how families receive those services. It's an unfairly complex system in each of us. If I look at child welfare alone, our system is complex, behavioral system is complex. And imagine that most of our families have to navigate all of those systems as different entities, which just adds to stress and complexities for families that are already stressed and already going through quite a bit. Next slide.
So the outcome of implementation, which is where we are now with AB 2083, is looking at how will we take those values and principles and the core practice model and put it into action. And so what it really says is no matter where a family enters, whether they enter through Child Welfare Regional Center, County Office of Ed, or alike, that their experience will be one of integration, and where they're the agency for whom they are seeking services with will be utilizing practices that are trauma informed. And I think the most important piece of that is that the family's experience is that they are not, that the work that they are receiving with is well integrated, so that they're not retelling their story, and so that the partners that work with the family are speaking together, so that there is less confusion about what the goals are. And the goals are, again, as Wendy said, are really established by the family. So the experience for the family after we do full implementation of AB 2083 is really of a well integrated system, and one that holds their understanding of who they are in the world around cultural humility practices and racial equity values is really held. It is really held at the forefront of the work. Next slide.
So the next slide talks you through exactly what is it that we're talking about. What does this look like? So one of and these are where we are to date within the work within AB 2083, and helps give you some tangibles of what's happening. So for Santa Clara County, we have a signed MOU in place. We have established an executive leadership committee, and a technical work group has been developed. One of the goals of all of the counties required in AB 2083 is developing an operational manual of how we are all going to work together. So when Margaret provided that example of a child and family team meeting, which exists within the child welfare system, the hope would be that child and family team meeting, how will that look across all the systems? It shouldn't look different from different systems. It should be the same experience for the family, same requirements, same overall implementation of what's happening. So in that operational manual, there are key chapters and decision points that we are working on. The chapters that we must develop in that operational manual is teaming. How are we working together? What are those teaming meetings looking like? A data governance and data sharing. You see it all the time. Families have to fill out so much different paperwork for different entities. It's hard to share information, and that there's a balance between respecting families' privacies and what they need and being able to share data. An IPC, which is our Interagency Placement Committee. This is a committee that works to ensure high-level placements for children in getting them into those higher-level care placements. Right now, the ones that sit around that table is behavioral health, juvenile probation, and child welfare. The hope is to add in both our regional center and our county office of education so that access to those high-level placements and those needs for high-level children does not just come with entering one of those systems. Entry and reentry services, intake services and assessment, some aftercare services for families, appeals and dispute resolution, having that look similar across different agencies, and shared training and shared requirements that can go beyond the county entities and into the community as well. How are we sharing resources and how are we sharing opportunities? Additional requirements and next steps for Santa Clara County. So these are also some of the requirements within this. We will need to have an analysis of gaps in placement types and services. Where are we in the county and what else will we need to do? Development of a multi-year plan to increase capacity and address those gaps. And then a link to readiness and needs assessment and links with other initiatives. Here is where I'll pause and lean into, we will need to make sure that at AB 2083, although this is about county entities working together, how will this link with other initiatives, such as the Families First Services Prevention Act that goes into the community? How will we do this in partnership with community and with children and families? Sitting in our advisory group, we have a parent partner right now. We will need to have a youth partner. We will need to have an advisory board that really helps speak to some of those things. And we will have to make sure that whatever plan is developed ensures the voice of those with lived experiences for that final operational manual. The other thing that you will see this work linked into that we will still need to work on is how does this link with the county work happening with the CAST, cross-agency systems team, and the single system of support. So all of those things are going to need to be integrated. Next slide. So here's where we'll pause and we'll take, I think we get 3 minutes for some questions because I know we've thrown a lot at you.
And I noticed there was a question regarding the inclusion of VMC and physical health. And just to let you know that we have had Curtis Ohashi, who is the director of inpatient services and is working on another similar initiative. Well, a larger initiative as well, has been part of our working group, and we really recognize the importance of having physical health be part of this initiative, and we do have public health is involved.
Thank you, Margaret, for acknowledging that. And I do want to say in other parts of the department, that's another integration. We have really worked to incorporate our partnership with health and hospital systems. And so that would be an important item to add in. Any other questions?
Dr. Yanis?
Yes, I don't want to become like biased, but we know that 65% of the families that enter the foster care system, 65%, 60 to 75% are Latino mothers and Latino families. Since this new model, which is, quite changing the system, how do you incorporate the voice of the Latino families into the design and decision making of these operational manuals?
I think that's a great question. That's one of those next steps that it will link with some of those readiness assessments and gaps analysis, and it will have to make sure that those with lived voice, and as you just lifted, we have here in Santa Clara County a disproportionate number of our Latino families represented, as well as our Black, African American, African ancestry families. And we know that we must also ensure a place and space for our Indigenous families as well. And so that will be one of the next steps before finalization of any operational manual. And then I will point out as well, an operational manual is only as good on the word on papers. It will need to be moved into action, which will be the hard steps for us to do. How do we shift our systems and our practices to really do the work differently, incorporate families? So those will all be next steps in this important part of work and linking with those other initiatives.
Wendy, what is the actual number for Latino population in the system?
So we range depending on where in the system you're looking, but overall we have an overrepresentation at 60% of our Latino families from the front end all the way through the system. So if you compare that with the population that we have, which is in the mid 30s, it's disproportionately higher.
Very high, very high.
Very, very high, yes.
There's something going on that we need to look at. Can you share a little bit, Wendy, about what about Gilroy? What is the percentage in Gilroy, California?
So that percentage stays pretty consistent across all of the county. I will tell you that Gilroy, our 95020, is our highest number of referrals that come into the system, and it is disproportionately Latino. We know, obviously, you know that there's a high number of Latino Spanish-speaking families there, but the significance of disproportionality looks very similar across all of our county, and we have those hotspots, Gilroy being one of those.
Have you identified why is that so high across the board? Is there identifying markers of why that is, and can you share a little bit about that process and what can we do to change the narrative?
Sure. So, and I will lean on my partners from DFCS as well. I will tell you that we have struggled with disproportionality over many years. We have moved the needle on reducing the number of children and families that are coming to our attention and that are coming into care, yet we have not moved the needle in a way that we would like to see on disproportionality. And so we are strategically putting different initiatives, and that will be something that we will absolutely have to partner, whether it's AB 2083, these other initiatives, we're going to have to partner with communities on this. You probably noticed from the presentation from Rocio that the numbers of calls we get, those 20,000+ calls that we get to our hotline, those are disproportionately families of color coming to our attention. So it starts from the front door and what happens in the communities. And so the ask that we will need to do with all of you as stakeholders, with community, is to move that needle on disproportionality. So we're looking at strategic ways to look at it. What's happening within our system that is includes bias? How does it look on the work we do with families, and inviting more families and community in to help us move that needle? And I'll stop there and ask for a partnership from Damien or Dan if they want to weigh in.
Yes, good afternoon, well, good morning still, everyone. The only piece that I'll add specific to what Wendy offered at the end is when you look at the general population, particularly Latino and African ancestry, it almost doubles in regards to numbers of calls from the community. So definitely that is an opportunity to work together in, especially in a lot of those referrals being unsubstantiated, working with the community to see how we can divert to other efforts.
And I'll just add in, because I know that we need to transition, because we're going to probably have to go pretty quickly in the last bit of the meeting. The county as a whole has really been looking at this, and there's if those of you may have heard something called CAST, the Cross Agency System Team, which is a both a county as well as a stakeholder group that's been meeting for several years. And one of their focuses is on prevention and really digging into this particular topic. So, I think that maybe when we wrap up and we look at our next one of these meetings, that maybe we just carve out more time to have a specific discussion about some of the work we're going to be looking at around disproportionality, both within DFCS as well as, I think, community-wide.
Thank you, Daniel. Just real quick, we mentioned bias. Is it also lack of income? The other issue is it's systemic, because, and I say that because if you look at Gilroy, I'm talking about Gilroy specific, you look at the arrest records of youth, boys and girls, and Latinos and Latinas, it's way higher, disproportionate from San Jose's arrest records and zip codes areas. So there's something going on, and I appreciate you, Daniel, saying that we need to have a conversation on this particular topic alone to really look into what are the causes, because I think if you're affluent, you have money, it's not going to go any further than that, because they'll just hire an attorney and they'll get it shut down. Whatever allegations are being made, it goes out the window. And so there has to be something said about the marginalized communities in Santa Clara County, in particular people of color, of why this is happening and consistently happening year to year. We need to address it. I would appreciate another meeting sometime to really speak about what's going on in that area. Thank you.
Yep, absolutely.
Yeah, maybe I can you hear me? Maybe I can add that the statistics of poverty below the federal poverty level in those zip codes where the majority of the families are Latinos in the foster care, the poverty level is as high as the withdrawal of the children. So most of those families who are withdrawn are 65% or 70% below the poverty level. So here we are that we equate neglect with poverty. Therefore, we remove children because they are poor, not because they are being neglected. So that reference, that statistic, that coincidence is very, very powerful. Unfortunately, we should have also the data about where are the family economic level of those who are being removed. And then we will know that there is a kind of high correlation between poverty and neglect. And therefore, we have to address poverty, not neglect. We cannot criminalize poverty when it is just a condition that families have no control about that.
All right, we've had some good questions. If you have additional questions, please do put them into the chat because we do need to move on. And presenters, please look at chat to see which ones you can answer. All right, so with that, we're going to move to local continuum of care build-outs update. Damien?
Yes, good afternoon again. So I'll be fairly quick because we are a little bit behind schedule. So in regards to the local continuum of care build-outs, in regards to staffing, looking at our scattered sites, which I'll talk about a little bit after this, and looking at the design that we currently have, we needed to add staff to make sure that we come into a staffing pattern that works for youth, as well as making sure that there is opportunity in regards to needs of the youth because they're pretty high acuity and addressing that. So at this particular juncture, we're looking at 12 plus positions for social worker 1, 2 social worker supervisor positions, and the expected date for that is either late May or early June in regards to making sure that those positions are in place and onboarded. Next slide, please. The other piece is looking at opportunity for county-ran facilities to address some of the needs. One, to move us towards licensure in regards to those particular needs around the temporary shelter care facilities. We're looking at 2 of those with the capacity of 2 per home. We're also looking at the short-term residential treatment program. I'll explain a little bit of the difference. So that temporary shelter care facility is really looking at a transitionary facility that supports that youth in their getting to a placement. So it's not meant to be a placement. It's not meant to be somewhere where that youth stays longer than several days. an SDRTP, or short-term residential treatment program, is really focused on some very specific treatment for that youth to make sure that they're able to step down into a lower level of care. SDRTPs are the highest level of placement. Sorry, SDRTPs are the highest level of placement that we have in our California system, at being at level 14. The last piece of that is time frame. So in working with the state, we're looking at several months to get these transitioned over to licensure. We're also going to have to work with our partners, whether it be behavioral health or probation, to really make sure that these are implemented correctly, as well as our own internal staff. And I think I transitioned to some of our partners to explain the build out a little bit more.
Hi, I'm Ida Tamarin, and I'm from the Office of Research and Evaluation at SSA, and I'm going to be presenting some results from the quarterly evaluation of the continuum of care with my colleague Kali. So the continuum of care is a range of individualized and home-based foster care for children and youth, and services for children who entered foster care, right? And so what we did was for the first quarterly report, we did a cohort analysis, meaning we looked at the cohort of children who entered foster care in July to September 2021, and compared it to a baseline of children who entered foster care 1 year before that, which is July to September 2020. And so one thing that we immediately noticed, and as Wendy noted, is that DFCS have moved the needle into the number of children that enters foster care. There are significantly less children who entered care in July to September 2021 compared to 1 year prior. In 2020, it was 179, and in 2021, it was 71 within that 3-month time period. Next slide, please. In the report, we looked at a number of things, but we're going to highlight just some findings here. And if you're interested, there is a more full report that looked at demographics, relative placement, step up and down, entry and exit to foster care. But in here, we want to highlight placement and non-foster care facilities. Now, non-foster placement are places like relative placement or maybe STRTP or resource family homes. Those are considered placement. Non-foster care facilities are places like juvenile hall or medical center or the receiving center. So we wanted to look at both of this to see like where do children go within the first month of entering care. And one thing that we noticed immediately is that within the first month of entering care, more than half of cohort 1 actually only had 1 placement or non-foster care facility, whereas nearly half of the baseline 1 year prior had 2 placements, meaning within the first month, they went, for example, to a receiving center and then they got placed. Whereas for cohort 1, maybe they went immediately to a relative placement and stayed there for at least for the whole month. So that's the key point that we found, that children in cohort 1 had less placements than the baseline within 1 month of entering care. I'm going to hand it over to Kali.
Thank you, Ida. Next slide, please. So one of the other key areas we looked at for the quarterly report was the welcoming center, and basically looking at it as a receiving center, so where children stay between placements, and ideally they should be there for less than 24 hours. So the children in the baseline cohort stayed at the receiving center called the Keiki Center, and the children in this cohort were staying at the welcoming center. So just comparing some key outputs for these children, we can see that in the baseline cohort, there were less children and a smaller percentage of the cohort who went to the Keiki Center. So that was 135 children versus just 41 children, or 58% of cohort 1 who stayed in the facility. And when we compare the average days that a child stayed, we can also see that there's quite a stark difference there. So in the baseline, children were staying on average for 4.5 days versus less than 1 day in the welcoming center. And then similarly, if we look at the number of children who overstayed, so this is staying there beyond the 24-hour period that is preferred that they stay there. There were 40 children, or about 30% of the cohort, who stayed there for over 24 hours, compared to 5 children in cohort 1, which was just 12% of that cohort. And finally, when we look at average overstays, we see a really large difference there. So in the baseline, the average overstay for children was 14 days compared to just 1.8 days for cohort 1. So I think the key point here really is that outputs for children in cohort 1 across the board at the Welcome Center were better than baseline. And again, this is also within 1 month of entering care. Next slide, please. Thank you. And when we spoke with some of our partners, so lessons learned, we saw that could have improved these outputs. So there were placement coordination meetings, placement stabilization services, as well as a 24/7 acute placement pilot program that might have helped teaming that also really allowed children to be discharged from the Welcoming Center within this 24-hour window. There were still some challenges and areas for improvement. So there was a desire for increased collaboration with county agencies and other service providers to make sure we have a full option of services for children and youth. There are also challenges in finding placements for older youth with high acuity needs. And finally, there was a need to facilitate child and family team meetings for all children who recently entered foster care. And I think we can hand it over for questions now.
Just a quick comment question. The data that for the overall data for the Welcoming Center, is that current? Is that last year's? Is there a difference between the pandemic versus non-pandemic?
Yeah, so the data for the
go ahead. Go ahead.
Oh, go ahead. Damien, were you going to answer?
No, I was just going to say the data is only representative since May, because that's when the Welcoming Center opened. So there is no pre-post, if you will, before COVID. But I'm sorry, Ida, go ahead.
Yeah, I was just going to say the same thing. It's the same. We looked at like data of that. We didn't look at data of everybody who entered the receiving center, only of children who entered foster care, the cohort and the baseline, and who ended up going to the Keiki Center in 2020 and then the Welcoming Center in 2021. So like Damien said, both of those are post-pandemic, like are during pandemic, current pandemic. Yeah.
Thanks, everyone. And I do know that there was a lot of good discussion, and I think we have some ideas potentially for the next session, because we're kind of bumping up against the time. There may be some more questions. I do want to open it up that if people want to submit in questions to us, I think we could still answer those and potentially provide back some responses to the group and kind of capture some of the stuff that's been in chat. So, Nora, is that something that we could potentially do?
Yes. There is the link that I sent out with the registration where you could put in questions. So we look at that all the time. And if you have additional questions, we can make sure that you get an answer, but you do need to provide your contact information so we can make sure that we get back to you. I think one other thing we wanted to share is where the fact sheets are. Shall we share that real quickly?
Yeah, I think it's a good idea.
Okay. So John, I'll have you stop sharing. All right, and let me go to. All right. I'm going to take you to our DFCS, or I'm going to take you back to the community website. Okay. So if we go back to the link that you see where you got the presentation, you go up here to About Us and select DFCS. It brings you to our page. And if you scroll to the bottom, you'll see a link for the archive as well as any annual reports that we're just starting to populate here. So if I click on Fact Sheet Archive, we'll see that we post them monthly, and then we have a year to 2021. I go to the year end. This is the fact sheet that's available for all of 2021, the total number of incoming calls, what the if they were evaluated out, which ones, how many were in-person response. We scroll down and we see the allegation types. You can see here under dependency investigations, in custody removals versus out of custody, number of petitions filed, number of children for whom services started, who they ended in the year, the various cases, family maintenance, family reunification, permanent placement, and supported transition, the total number of children who received child welfare services in the last year. There's also child characteristics, age, ethnicity, gender, and then out-of-home placement numbers. Okay, so this is all available. We go for about 5 years now that we've had these. So that is the fastest way to get to our fact sheets, is from that link that where you got the presentations. Okay.
That don't have access to that?
It's external.
It's external. Yeah. Okay.
Oh yeah. Mm-hmm.
And Dan just put in chat the link directly to the Child Welfare Indicators Berkeley website that everyone should get access to as well. So you can click on that and save that.
And I would encourage too that we should be sending something out prior to the next session that if people have specific questions they want us to cover, to send those to us so that we can make sure to include that in our presentation. You know, otherwise it was really good to see everybody. Thank you all for engaging and asking such really good questions. We'll work on providing some of the additional responses that were in chat. And then, you know, as you're looking at the data, either our fact sheets or that Berkeley site, which really shows the statewide the federal indicators. You know, if there's questions, reach out to us too, and we can definitely talk to people offline. So I think
my name is Marisa, and I'm a foster parent, and I submitted a question. I can ask it directly, or have we run out of time and it needs to be addressed offline?
Yeah, thank you for that. Yeah, there was a question submitted regarding the adoption timeframe. What I would say is, I think in your situation, I've asked that the team reach out, that we be able to reach out directly to answer your case specific. So maybe if you want to, hey, somehow we need to connect you with Wendy.
I guess my concern isn't my specific case, it's the overwhelming or not just my case, but, you know, I'm involved with many foster parent groups, and it's an overwhelming issue, this delayed time. And all these wonderful resources you guys spent the meeting discussing, it just seems like, you know, we're signing the form saying, hey, we're willing to be a continuing home for these kids. Pretty much the day you give us the kid, you give us a form to say, would you be a potential permanent home for this child? And when it's identified as yes, it's just still confusing why it's taking over 2 years. And obviously we'll get some pandemic slack. But for an adoption to happen, it's just those resources, the financial impact of a child who has been sealed off for adoption 2 years ago and is still in the system, meeting with the social worker every month, taking up a court every 6 months. It just seems like this money can go to the families directly, these children directly, instead of having a child on a docket with a continuing social worker and an adoption worker and in the court system, when there is no need because they have a loving home that has been identified 2 years ago. From parental rights, we're talking 2 years ago. But really, since the child's been in placement, you guys are asking us if we're willing to be a continuing. This case is taking, it's okay. It's just that we became foster parents to help reunify families, and we're seeing this, you know, money that could be spent doing that spent with a child who has been ready to be adopted 2 years ago, and she is still costing the system tons of money when that money could be going to the families fighting poverty, fighting the drug crisis in California, in the Bay Area. You know, I'm from East San Jose. I'm in those zip codes that you guys are describing, and I'd love to see the money put there. So that is my comment. That is something that I would really appreciate you guys tackling. You know, these kids are ready to be adopted, and they're sitting in the system for 1 to 2 years more.
Yeah, and I know that there are some procedural things that Wendy and her team are looking at. There's unfortunately complexities with the adoption process just itself that I think we're trying to see if there's ways to build efficiency into that. So there are some general procedural improvements that I think we're looking at. I think for your specific one, I still would want to make sure that we connect to see what's happening with your particular child in your situation.
Okay. Yeah, I think, you know, efficiency is the name of the game. I'm in the healthcare industry, and, you know, when a diagnosis is identified, we are morally and ethically responsible to make sure that that is treated in a timely manner. And I know that this industry should be held to similar efficient standards to not waste the money of our taxpayers, and just to be really good stewards of the money that is in this system, keeping families together or supporting the kids that cannot reunify.
All right, thank you.
Hey, Daniel, just a quick comment. If you maybe one of the, I don't want to, it's too long to put on the chat, but just real quickly, if we can maybe have a discussion on how the gal just spoke right now about foster care kids. That's one topic. The other topic is the range of funding that they provide to the families that take in the youth versus funding that's applied to other silos that get more money. We can maybe talk about that in a future meeting of how that works, and why isn't the funding for a foster care higher now? It's so low. I think that should be also something to be addressed. And how many kids do we have that are waiting to get funded, or kids that are waiting in the wings to get housed? We can push them all out if the funding was higher for families willing to take them in. Thank you.
Yeah, thank you. All right, I think again, really good questions. If there are things that come up before the next meeting, please reach out so we can answer that. Otherwise, you know, we'll plan on meeting again in a couple months. Hope everybody is safe and well. And again, just thank you all for the partnership and collaboration. Thanks, everyone.